Good afternoon, everyone. I'm Omar Khan. I'm the Chief Executive of TASO, the Center for Transforming Access and Student Outcomes in Higher Education, and you're all here for the launch of the Student Mental Health Evidence Hub. Before we kick off, a few housekeeping points, and I know some of you are still coming in. So you are all automatically muted and your videos are off. This is the webinar version of Zoom. We are anticipating over 600 people registered for this event. So during the panel sessions throughout the day, we do want you asking questions, but please use the Q&A function. And due to the large number of attendees, we kindly ask that you ask your questions throughout the event rather than at the start of the Q&A. Otherwise, we won't be able to prioritize or read them and answer them. Also, due to the possibly large number of questions, we will have to answer some online, and we will be sending a recording afterwards, along with some FAQs that will, answer the questions that we were unable to answer online. As an organization committed to evaluation, we also want to evaluate our events. So we will be sending you feedback, and please keep an eye out for that post-event survey in your inboxes. I think a few of you already have done so, but we have enabled closed captioning for those who wish to use it during the event. To access the closed captions, please select the captions icon in the toolbar at the bottom. So a quick overview of the session. We're really excited to launch the Student Mental Health Evidence Hub. This has been a consortium project that we've worked with Amashi, Smarten, Student Minds, and What Works Wellbeing, who you'll hear from later today. We're also looking forward to hearing from two students involved in the project and speaking with Professor Edward Peck about his work as the Higher Education Student Support Champion. I will introduce the speakers as we run through the program with each panel. But first, to kick us off, we're going to hear from the project funder, the Office for Students, from John Blake, the Director for Fair Access and Participation at the Office for Students, who will provide some introductory remarks. And John, I'm going to hand over to you now.
Thank you very much, Omar. I think one of the joys of my job is being able to support organizations like TASO and others to build the sort of work that's being talked about here. So colleagues may be aware that the OFS is the regulator for higher education in England. And we have a broad range of interests across quality and standards and equality of opportunity in the higher education system. And one of our key strategic goals in our current period is to do some really serious thinking about mental health and the impacts of higher education on the mental well-being of students engaged within it. And it's a particularly interesting area for us, because it is one in which, in the first case, the evidence of the long-term mental health benefits of going to higher education seem relatively clear. In the long-term, higher education is a positive for almost everyone who steps into it. And indeed, insofar as we can analyze some of the data, it appears that mental well-being amongst students is at least as good as, if not better than, that of their peers outside of the higher education environment. But of course, it doesn't mean there aren't significant challenges, and we absolutely recognize that, and that's why this is one of our strategic goals. But also because of the nature of the challenges, it's not an area we think would benefit from more stricter statements of regulation. It's an area that needs everyone to come together with an inquiring mind to understand what the particular challenges are, and what the solutions might be in the hands of higher education. Spend a lot of my time talking to higher education providers about issues, many of which are not entirely within their control. So our interest in ongoing progression and success for students after higher education, our interest in disadvantaged students being able to access higher education, are other examples of areas where, of course, universities and other higher education providers don't control all of the levers, but we're interested in them using the ones that they do control to make the best and biggest difference. And of course, mental health is another area where many of the most potentially impactful interventions sit outside of higher education and are within the NHS. Um, and that further, some of those interventions, medical therapy or indeed medical intervention, really need an expert eye and aren't things that can be picked up by even the most effective of pastoral systems. They need to be passed on and dealt with appropriately. So there's a whole series of challenges about thinking about what the precise nature of the issue is for higher education and how that's different for different types of students. The mental health challenges in a provider that is primarily 18 to 21 undergraduate residential is very, very different from that of one which has a significant number of postgraduate students or that has lots of commuter students. So there's there's lots and lots of complexity in thinking about where the challenges come from, how they relate to the purpose and function and setup of the higher education provider concerned, and how that provider fits in with the wider landscape of mental health and well-being for the students who come through their doors. And because of that, we wanted to recognise in our activity around this that complexity and to work with both the higher education sector and third-party organisations, third sector organisations rather, to really dig into these challenges and to make sure that we're constantly improving the work on mental health and well-being in higher education, but also that is done through building the evidence base. And that is part of a wider focus on this that we've introduced through our work on equality of opportunity, through our renewal of the access and participation plan process. Those of you who no access and participation plans know they are the requirement for a higher education provider to access significant additional public funds and to charge the higher fee and so on and so forth. So they're really important gateways for higher education providers, and the deal is that they will do particular work on access, success, and progression for their students. And the way we've reframed that over the past year or so has been around our equality of opportunity risk register, asking providers to think very deeply about which particular challenges manifest for their students. Are there ones that are particularly unique to their provider? Are they ones that they share across the whole sector? And to think through how to do that, to build their plans around that work and focusing on the change you want to see, not on the specific student group, not even necessarily on a specific metric, but on thinking about the aggregate of the impact. Mental health is one of three areas that we've been very clear we think are likely to impact absolutely every provider in some form or another. But also an area where, as I say, we feel that the most appropriate way forward is through research, evidence gathering, and collaboration. And I'm delighted to see this work go forward. I think it's an excellent example of that joint commitment to take effective action, to be held accountable for the impact of that action, but also to acknowledge that there are some things we don't understand at the moment about what's going on with mental health in higher education. There are new avenues will open as we move through doing our work in this, and that we need to be open to new lessons, new departures. And the best way to do that is to conceptualize what we're doing as building an evidence base for activity and action. And that's why it was important to us that there be a hub for that evidence, and why I'm delighted that TASO is leading this consortium and taking that work forward. And I'm really interested to hear more about what they're doing today, and for you to hear more about what they're doing, and for that work to get started. So thanks to all of those of you who are involved, and thank you to everyone for showing such interest in this work. Thanks very much.
Thank you, John. Yeah, as ever, I'm impressed with your understanding and your commitment to these areas, from widening access and participation, but also obviously today's topic, which is student mental health, and outlining the Office for Students commitment. I'm going to move on and hand over now to outline some of the findings that actually John has already indicated in terms of the evidence base on what works to address student mental health, and explain further the Student Mental Health Hub, which we are launching today along with our consortium partners. My colleague, Dr. Eliza Kozman, our Deputy Chief Executive, is going to be presenting these slides.
Great, thank you very much, Omar. Yes, so it falls to me to give you a brief overview of the actual hub, which is the resource that we're launching online today, and you can go and look at immediately after this launch. So it's important to note that this project follows work that we've already been undertaking on mental health. So we've undertaken reviews on this topic, as has King's and Smarton and What Works Wellbeing, and all of these reviews have uncovered that there are significant gaps in the evidence on what works to improve student mental health and wellbeing in higher education. Next slide, please. It's really important to note that this is coming in a response to a significant increase in demand from students for mental health support. So 1 in 6 students now report mental health difficulties when they enter higher education, which is a huge swell in the numbers. So there's a significant need that the sector is responding to. And as John's indicated, a joined up approach is needed to respond to that demand. And we're really delighted that we've been able to do this via a consortium with other partners who are passionate about addressing this issue. So our consortium members are listed up on the slide. We're incredibly grateful to Moshi, King's College London and Smarton, Student Minds, What Works Wellbeing, and of course our funder, the Office for Students, for funding this piece of work. I also want to flag our student panel, who are a really important part of this project and helped guide us in terms of how we think about and frame the evidence. You can read all about their involvement on the hub, and I hope that you'll see and hear a little bit more about today about how students are really at the heart of what we're doing to try and improve outcomes. Next slide, please. So, to the hub itself. So who's the hub for? Well, the hub actually has appealed to a really wide range of audiences, we hope. So practitioners in student support services, I think we have a lot of those on the call today, but also policymakers, evaluators and researchers, and anyone who's interested in the evidence on how to improve and support student mental health in higher education. We hope there's something in there for all of you. The hub has 3 pillars, which I'll briefly touch on in the following slides. So an evidence-based toolkit, evaluation guidance, and examples of current practice. And I do want to flag at this stage that this evidence is very much focused on higher education. So we have been very specific about the coverage and the focus of the evidence that we're looking at. That means there is other evidence out there that covers other populations, but we hope that by zooming in on the HE specific evidence, this is a really, really useful tool for the higher education sector in particular. I also want to flag that the hub will grow. So this is the kind of the birthday of the hub, but there are opportunities for this to grow and evolve, which I'll speak to a little bit in a second. But this is the starting point rather than the end point of certainly TASO's work on student mental health. So let's move on and have a little bit of a look at the specific elements that I've mentioned. So pillar number 1 is our toolkit. And this is essentially a searchable database of pages on specific interventions or activities that you might want to run or you might already be running to support student mental health in your context. So we have pages, for example, on recreation activities, on physical activities, on psychoeducation. And for each of these pages, you can read a précis of what the current evidence tells us about how effective this approach is at improving or supporting mental health outcomes. We've tried to make this really actionable and useful, so we've included options that allow you to filter by the Student Minds mental health charter domains, but it's really important to flag that you don't have to understand those domains to be able to use the toolkit. This is an open access free resource that's hopefully useful for a really wide range of audiences. At this point, I just really want to emphasise our thanks for King's, Smarton and What Works Wellbeing in supporting and informing and working on the evidence review that went into the toolkit, and also to Amoshi for helping us test multiple times the way that we're presenting and talking about evidence with members. So we really hope this is accessible and useful to a really wide range of audiences. Moving on to the next pillar of the hub, this is our evaluation guidance. And for those of you who know TASO from our other areas of work, evaluation guidance is our bread and butter. So we're all about trying to help the HE sector do more and better evaluation. And what we've done this time is try and take that evaluation guidance and tailor it and make it really specific and useful for those of you working on student mental health specifically. And I just want to flag 3 things that I think are particularly useful for those of you who work on evaluation who are here today. So number 1 is our guidance and outcome measures that's been developed by Smarton and King's College London. And this is a really excellent summary of different outcome measures that you can use in a non-clinical context. And you can go away tomorrow and pick those out of existing publications and integrate those into your evaluations. And what we hope is that by providing this, we get more consistent use of these high quality outcome measures and better monitoring and tracking of how impactful interventions are in the sector. On practice, we know that practice doesn't just materialize out of thin air. So you're often inspired by practice from other contexts, but it's really important to think about what you should be considering when you're adopting and adapting practice from other contexts. And we're grateful to Student Minds for developing a great piece of guidance on the questions you should be asking yourself when you're taking practice from other contexts and integrating it in your local context. And finally, we have some examples of theories of change and also research protocols, which are worked examples of how you could develop evaluation materials specifically on student mental health. And these use TASO resources, which are freely available on the hub. And I just want to acknowledge Leeds Beckett University, Sheffield University, the University of East London, and University Mentoring Organisation for being so collaborative in piloting these approaches and then sharing the results to feature on the hub. And we hope they inspire other people to go away and do similar work. Finally, if we move on to the 3rd pillar of the hub, we are talking about practice. So obviously what we all really care about is the work that's going on to support students in the HE context. And we know that there's an awful lot of evidence that isn't published. It's certainly not in journals. You may not even talk about it beyond the walls of your university or college. But we really care about that practice, and we've tried to collate some examples of that, which are featured on the hub in a very structured and transparent way. This collection will grow, so we'll be releasing more examples of practice over the coming weeks and months, and we also want to hear more from you. So if you look in the toolkit and you think, well, TASO's missing something here, I've got a really good example of X, Y, or Z, send it to us. There's a portal and we would love to hear more. So please do watch this space, as this is a growing resource for the sector. And how does this all fit together? So basically, we know practice is going on. We know there's a need for better support for students and more support for students. Let's evaluate that practice using the evaluation guidance that we've provided and turn it into evidence, which will then slot into our toolkit and then feed back into practice. So this all becomes part of a more dynamic and reinforcing cycle of evidence-based support for students, because that's what we believe they deserve. And I'm sure you'll all agree with that. So looking briefly at a very brief overview of the key findings from the evidence, because there's a lot of very rich content in there, which I hope you'll have a chance to go and read about. Unfortunately, there is no silver bullet. I would love to turn up at one of these events and say, just go away and do X, Y, or Z and it will fix this issue. But there is no silver bullet on supporting student mental health. But there are emerging pockets of promise and some things where we do have evidence that suggests there can be at least short or medium-term positive impacts on students. So the areas where there's the most promise in terms of existing evidence are psychological therapies and also psychoeducation. But the huge limitation of a lot of this work is that we don't have a lot of evidence from the UK specifically, or from higher education specifically. And so there's a real clear need for us to develop that evidence base using the evaluation guidance, which I've just mentioned. We also know there's a lot of work to going into producing more integrated care and inter-system collaboration, whole system approaches, these more nuanced approaches, but we find a real lack of evaluation on these approaches at the moment. So we'd love to see more evidence in this space. And we also need more evidence on preventative care. So psychological therapies for which there are the strongest evidence are not the kind of approaches which are just going to help universities be more mentally healthy in the first place. And TASO, and I'm sure the consortium, would love to see more evidence on approaches which help keep students mentally healthy, and that we can show those approaches are effective. So that's a real whistle-stop tour of the hub. I hope you find it a really useful resource. Please do follow up and submit your practice and help us keep growing this really important area.
Thank you, Eliza. Yeah, very good overview of what the hub contains, and hopefully after this launch, or perhaps even before this launch, you'll get a chance to use it yourself. It's now launched. You can check it out on our website and look at those 3 different elements and how they'll contribute to improving evaluation and the evidence base, and ultimately benefit students in terms of their mental health outcomes. As Eliza also indicated in her presentation, involving students was a central part of this project, and we're now about to hear, we'd like to hear from 2 students who are directly involved in the project. First off will be Emily Birchall, who worked as a research intern on the project, and after Emily speaks, we'll hear from Lauren King, who is a member of our student advisory panel. Eliza indicated that as one of the elements in this project, and Lauren will speak about her thoughts on being involved in the project. So first, over to you, Emily.
Thank you for that introduction, Amar. So as you mentioned, over summer, I worked as a research intern at TASO, where I was solely contributing to the final stages of the Student Mental Health Project, which is launching today. So more specifically, I worked on 2 strands of this. So the evidence toolkit, looking at past research into mental health interventions within higher education, specifically implementing the University Mental Health Charter categorization, which comes from Student Minds. I also got the chance to work on the examples of practice section of the hub, so where I created templates for the pages based on submissions from higher education providers, detailing the mental health interventions that are currently being implemented within the sector. So from my work on the evidence toolkit, and as Eliza already touched upon, there were a few clear gaps that emerged. So there are a limited number of interventions that fell into certain categories for the University Mental Health Charter. And then additionally, there were generally a lack of research done within the UK higher education system, but in particular research that utilised causal methodology. So these gaps highlight the need for there to be a continued focus on evidence-based evaluation within the UK higher education sector, particularly when it comes to researching student mental health initiatives. Student mental health, as you all know, is an ongoing point of discussion amongst the higher education providers and the media, with the debate around how best to support students. Whilst it is important that this remains a priority, it's equally important to ensure funding is being put into interventions with a proven evidence base. This requires continual evaluation of ongoing projects that incorporates the student voice to ensure student mental health is being tackled effectively, with evidence-based practice at the forefront.
Thank you for that, Emily. I am now going to hand over to Lauren to give her observations. Thank you, Lauren. Sorry about the tech. I know it's a little bit tricky to pop in and out. Thank you for being here.
Thank you, Omar. So yeah, I'm a student on the TASO panel, advisory panel. So our role was to provide qualitative feedback on our real life experiences, while TASO brought the science and the data. Our feedback only reflected and amplified the need for the hub's invaluable resource. And with that, my key reflections from the project were: all students on the panel wanted mentally healthy universities. We want our universities to provide innovative mental health interventions, of course, and we want to belong and feel safe and connected. We want to work with the governance and support staff at the universities, not against, but in collaboration with. We want to feel heard and our opinions valued. And another interesting reflection was that a lot of the student desires for mentally healthy universities were person-centered in nature, whereby mental health support should be tailored to accommodate for the diverse range of students entering the ever-changing higher education system, more BAME, disabled, working class, carer, care leaver students, etc. Because although students may leave their homes behind to come and study, they bring with them their whole lives. All that experience that shapes the way they think, feel, and view the world. So varied and vast, our universities prepared to hold all that responsibility and support their mental health needs. Based on my experiences working with TASO and as a current higher education student, to the higher education sector, I want to say we are in a depression, even though it feels like no one is saying it yet. With COVID-19, the cost of living crisis, climate crisis, the NHS crisis, war-torn countries, Even the primary and secondary education system is seeing the earliest long-term impacts of COVID-19. With more pressure on our education students as well to rectify this, we can't just let things take a natural course and neglect to prevent unavoidable suffering of our students. As a student governor at Edgehill University, I'm bragging, I know risk somewhat. I know that universities won't put their students in any situation that may cause them harm, and least of all harm to the establishment as a whole. But the mitigation associated with implementing new crisis interventions is being greatly minimised with the assurance that this new TASO hub provides. So with that, I'll say, take the first steps. Use this hub to provide your students with the best mental health support out there. Give them the chance they deserve to thrive and be certain of themselves in a very uncertain world. Thank you.
Thank you so much, Lauren. It's really vital that we get to hear the student voice. And I think one of the things that both Emily and Lauren indicated is how this is an urgent need for students and the benefits that will accrue to so many students. We now know that up to 1 in 6 students are reporting mental health difficulties at undergraduate courses in Britain. So it's an increasingly reported consideration. And we're now going to be talking to Professor Edward Peck, who is the Vice Chancellor of Nottingham Trent University and the Higher Education Student Support Champion. Good afternoon, Edward.
Good afternoon. Nice to be here.
Good. And thank you for being here. I assume you've heard some of the conversation so far, but I thought we'd start with your role, actually, and asking you a question around reflecting on what you've heard so far. What are you hoping to achieve through your work as student support champion and with the Student Mental Health Task Force?
Great, thanks, Omar. And in fact, I have listened in to the whole of the session so far. And actually, I feel quite close to TASO because NTU was quite involved in its creation, which is why Eunice Simmons, who is your chair of trustees, is our erstwhile DBC. And of course, Jane, one of your trustees at the moment, Jane McNeil, is currently our PBC Education. So it was great to support an organisation that we were in at the ground floor of creating. So it's great to be here. I was appointed in June 2022, and when Michelle Donnellan wrote to me, she wanted me to help share best practice, promote innovation, and I think convene and cajole where necessary around good practice and student support. And initially, I consulted the sector on what they thought that my priorities should be, and that includes students' unions, sector bodies, higher education providers. And they were talking a lot about mental health issues at that stage. Volume and complexity, I think, that institutions are seeing. The relationship with the NHS came out very strongly, and how that could be improved in the interests of students around specialist mental health services. There was lots of concern about the transition to higher education, resilience, independence, information. They were starting to think about redesigning their student support systems, particularly concerns around the personal tutor system, how robust it was at dealing with all students, particularly students who had mental health challenges. And then finally, they were very interested in student analytics, how you use data, particularly to identify and perhaps use some nudge techniques to support students. And then 12 months on, I got another invitation from another minister to chair the Mental Health Task Force. And this is to oversee a programme of work that addresses a number of issues that have been raised, particularly by students, by parents, but also by students and by MPs. And there are, to quickly over 5 areas. The first is identifying students at risk. That does include analytics, but there are other methods as well I could talk about if that was of interest. There's a concern about how compassionate our policies and procedures and communications are in higher education providers. There was, I think, an issue about how much universities learned from the tragic episodes of suicide, and could we have a more systematic approach to both local suicide reviews and maybe a meta-analysis of those case reviews. How consistent is adoption of good practice, and where are we with the mental health charter frameworks? And then finally, what else would people like us to look at as a task force, a strand of work called further areas of improvement? So the first 4 areas are making real progress. The 5th one is still taking ideas. If you have any, please drop me a line. So broadly, that's what I've been asked to do by 2 different ministers of state in the last 18 months or so.
Great. Yeah. So you've outlined your priorities and how they've been determined. I was going to follow up by sort of saying or questioning how far you think this evidence hub and how it could support you in those priorities.
Yeah, well, I was really keen to come to this session because I do think what I see out there in the system is lots of innovation, great ideas, particularly from practitioners who are trying to solve problems they see in front of them with new and creative ways, often under resource constraints. But despite all that innovation, there's not an anecdote about what works. There's not much, as you have pointed out in the start of this session. There's not much evidence, which is surprising, isn't it? Given we are a sector that prides itself in most institutions on doing research. We're not very good at researching ourselves. So I do think the emphasis both on promoting evaluation that you're going to do through the hub, but also bringing it together and making it accessible to practitioners is really important. And both strands for me are equally important. There's no lack of will and energy out there to improve services for students, but sometimes people both reinvent the wheel and sometimes then reinvent wheels that aren't as round as they might have been if they'd known more about what else was going on in other institutions, and that's where evaluation and sharing evaluation becomes really, really important.
Yes, and as we discussed previously, and as Eliza has flagged, there is strong evidence on those. In most areas, there isn't the evidence that we'd like to see, but one area where we do see strong evidence is on psychological interventions. Although some of those interventions are probably best or most likely to be delivered by NHS providers. And I was curious if you had any thoughts or any views about good practice you've seen on relationships between NHS and higher education providers, or ensuring that students have a smooth, not just a transition to from school to university or college, but when they need to be given sort of more special support, that happens as smoothly and as supportively as possible.
Yeah, it's a really good point because at 18 or 19, most of those young people go to university still do move from their local area of origin. So they face two dislocations. They face dislocation in their personal and professional support networks if they had them from where they came from, their family. But also they may move from services which are for under 18s to services which are for over 18s in the National Health Service. So there's two major points of dislocation that face many of our students at the same time, just when they're facing the new pressures of being an independent adult. And I think the most effective model I've seen is in Manchester, the Greater Manchester Mental Health Model, where they've created a student mental health team, where the referrals into that team predominantly come from student support services in the universities. And they look to deal with a particular group of students and their challenges. I have expertise in student mental health and looking after students of that age with those sorts of challenges. And I think that's a really robust model because not only does it create a better and more coordinated service for the student, it starts putting in place some boundaries between the responsibility of the NHS and the responsibility of higher education. And I think one of the major concerns I hear from universities is that sometimes they think they're overstepping what they're capable of doing because they want to help, because they don't like to see students waiting for specialist help, where in fact specialist help would probably be more appropriate. And there may be issues for expertise and experience in delivering some of those interventions. So I think it's a major area of focus. And we've had some really good conversations in the last couple of weeks, actually, with the NHS, with NHS Confederation, NHS providers, about what we could do to get more of a Manchester model into a much broader range of geographies.
Yeah, clearly there's always going to be a need for universities to signpost to clinical care where that's necessary. We're also seeing, of course, and Eliza flagged this in the review, a real focus on preventative sort of models and trying to ensure that universities kind of culturally are a place that understand and are sympathetic to, and where students feel that it's not just they can report mental health challenges, but that universities support their well-being. So do you have any thoughts or ideas or examples of best practice around providers implementing a more holistic approach or a more institution-wide approach, or any observations on what that might look like?
Yeah, I think it's really work in progress still. But what's been really encouraging is there's been some work in Exeter University following a coroner's inquest around compassionate communication. That's their term, which I've stolen from them. looking at how you rewrite your policies and your procedures and the way that you then convey those to students, particularly those who are vulnerable or at times of stress, in ways that are much more empathetic and understanding of how they're going to be received. So, for instance, it's simple stuff, but you don't send out any of those communications on a Friday, and you don't send any out after 2 o'clock on any day of the week, because the student probably won't be able to get to source of advice and guidance before they worry about it all night. And I think there's something about that compassion in communication. They'll then start to work back into compassion in how procedures and policies are written, which starts to change, I think, the environment on a campus. Every communication, you should think about how this is going to be received. And I don't think that is universally the case, but I know it's not at the moment. But I've been really encouraged by the enthusiasm with which all the providers I've been interacting with have picked up on this, are doing things to really look, particularly initially, at the quality of their communications. So I do think there's a real understanding of that compassionate communication, and some people frame it as being a compassionate campus. I think it's a move towards that. I don't think we're there anywhere near there yet, but I do think it's a very positive move in that direction.
Yes. One thing I wanted to ask you about as well is I had cited the statistic that 1 in 6 students now report a mental health difficulty, and our student presenters Emily and Lauren did sort of raise that this is not any longer a sort of minor issue affecting a small number of students. I mean, obviously there may be issues around people being more willing to report mental health difficulties, somewhat reduced social stigma, but it does appear that there's much greater need for mental health support, and arguably not enough support out there for them. I mean, from your perspective, what do you think are those underlying or contributing factors that explain this recent rise in students reporting mental health challenges? Obviously, some of them do relate to cost of living and COVID, but looking at the data, it looks like there has been a longer term increase independently of those external factors, which of course are making it more challenging for students.
I think you're absolutely right. I think it mirrors what's happening in broader society, and students are a subsection, aren't they, of broader society, and particularly amongst young people seeing much higher levels of anxiety. And we had a session with schools over the summer, just talking to them about what they're seeing in the classrooms, particularly in kids in the later years in their schools. And they say this is not about COVID. COVID's been a contributor, but if we think we're going to go back to where we were pre-COVID, when the COVID generation has moved through, we're probably being over-optimistic, because it is about the impact of social media. A really good report yesterday by Student Minds on the impact of climate change on people's anxiety. I think conflict, the sort we're seeing in Europe and the Middle East, just leads to a sense of anxiety and uncertainty about the future. And I think that's a major factor. And how do we enable students to come to terms and be resilient about some of the events that none of us can change, actually, which are shaping their concerns. And then I think there are particular issues. I mentioned the dislocation of leaving home. I think there is a question about, for some students, is going a long distance to university or college the right thing to do? If you do have innate vulnerabilities, or other ways of thinking about how you go to study, which means you don't cut yourself off from those professional and personal support networks. You've mentioned cost of living. And I think the academic pressure is getting stronger, particularly strong the issue around vocationality and getting work. And I do think there is something about all of that, which is making the stakes ever higher for young people when they're at university. So I think it's a different environment to when I was a student, a very different environment, both personally but also institutionally. I think all of that is in the mix, Omar. It's not going to go away, and I think we have to work with what we've got, understand it, and make the best interventions that we can, both collectively but also individually.
Yes, no, I absolutely agree. I mean, one of the things in a previous report that TASO has published is showing that for some students, although they have higher levels of mental health difficulties, they also find that university, and this is something that John Blake cited in his introductory comments, a place where they can explore who they are, and this can actually increase their sense of self and potentially their well-being. And I think, understanding that those are benefits, and that, it's not just university students, but young people generally who have higher levels of mental health difficulties. And it does make me wonder if there's more that we could do to kind of amplify or lean into that experience of students kind of growing and learning and feeling positive about living away from home for the first time. I don't know if you have any thoughts or observations around that.
Yeah, so I think that's right. I think most universities and colleges now have something either more formal or more extracurricular, around thinking about yourself, your identity. Often it's called resilience. At MTU, we have the GRIT training program, had it for a number of years. It seems to help students think about who they are, who they want to be, how they're going to get there in a semi-structured way that really helps. The evaluation is very positive. So I do think there are things that institutions are doing. Of course, the problem is making sure you can do it at scale. And you've got 40,000 students, so scale's an issue. And also, of course, there's the very students who might need it most are the ones that may not have the confidence or the social capital to engage with the interventions on offer. So the ones that are least engaged might be ones that are struggling the most, would really benefit from those kind of interventions, but aren't getting them. And how we assertively outreach to those populations and those individuals, I think, is a really interesting question for all of us.
Yes, and before I ask you what the next steps are for the task force, I thought I'd pick up one additional issue that you've discussed previously, and that I know the audience is interested in, is this question of how we ensure that we have the right model in terms of whether it's personal tutors or other trusted contacts in an institution can be spoken to by students. So how do we ensure both that we, I suppose, identify the right kind of mechanism, the right kind of relationship, that relationship includes, trust and relation, but also that those people have expertise in the institution when a student does want to raise a concern with them. Conversely, maybe when a student, the challenge where a student is uncomfortable raising a concern with a personal tutor or another possible contact. So there's not really, I suppose, an answer to this, but any observations on how we better navigate that challenge?
Well, I think you're right, Owen. As I say, it's one of the big questions institutions are struggling with, and I think that's a real opportunity for TASO to actually start to look at some of the different models. There are three models emerging. One is you develop your personal academic tutors to take on all those roles. I think it's probably the best solution, but there are many personal tutors who may not have the natural skills and abilities to do that, or may not think it's actually what they signed up to do. So I think that's a challenge. I mean, some will be brilliant at it and do it really well, but it's a mixed picture. The second is you have somebody else in the course team whose job it is to handle the pastoral relationships with a certain number of students. And the reason why they're in the course team and are presented as being part of the course team is that students usually look for their first line of support, the academics around them, who they recognise as being the university as far as they're concerned. So having some specialist expertise that is pastoral, developmental in the course team, I think might be a solution. And the third is you have a far more well-resourced professional services approach, where people very quickly get picked up by somebody who's an expert or specialist, but not a member necessarily of the course team. Now, idiosyncratically, we have all three models at MTU at the moment, not by design, I think just by innovation in our schools. But broadly, they're the three areas that are being explored. And we're having another workshop with UUK members, Universities UK members, in a couple of weeks to see what people think about those three models, what are their strengths and weaknesses, and crucially, what's the art of the possible, what's affordable here. I think the best solution is a member of the course team who has the expertise and experience and interest to be that tutor and that pastoral support. But it's an expensive way of doing it, but it may pay for itself if you manage to keep more students in the institution. So I think that's the direction we're going to take, but it's still an open question.
Yes, and hopefully the evaluation guidance that we've produced today will be helpful for you and your team in assessing the outcomes from that. Before you go, I wanted to just give you an opportunity to indicate any future priorities for the task force. You've also invited participants to respond to you via email. We will include that in the pack that we sent out, the email to reach you with. I don't know if there's anything else you wanted to say to this audience about your future priorities and ways of communicating with you.
No, so my address is on the website. There's a student support champion website. You can contact us through that. We haven't yet taken the potential future areas of work to the task force, so I think it'd be premature of me to flag what might be on the list. But I don't think it would surprise anybody who's on this call, and I think it's fair to say that the NHS higher education relationship will probably feature there because it just comes up so often in conversations, and it looks like we have a way of taking it forward. But otherwise, we'll probably have something more to say about that early in the new year, Emma.
Okay, great. Well, we've kept to time. I think you can stay on the call briefly to hear the panel discussion. We're really grateful that you're here today and for all the support that you've provided both to TASO, but obviously more generally across the country in terms of ensuring that student support and mental health are priorities at the highest levels of policy thinking and also in the higher education sector. So thank you to Vice Chancellor Edward Peck. We are now turning to the panel discussion, and the panel includes the other consortium members, members who brought particular knowledge, expertise that ensured that, as Eliza has outlined already in her presentation, that the various elements of this project were delivered in the best possible way. So I am going to have a facilitated panel discussion. I've got a few questions for each of them, and hopefully Emma Bales, the Vice Chair of Amashi, Dr. Nicola Byram, the network leader and senior lecturer in psychology at King's College London, the network leader for Smarten, Nancy Hay, the executive director of What Works Wellbeing, and Rosie Tresler, OBE, who's the chief executive of Student Minds, who you've already heard about on this call today, who published a report yesterday on student mental health and climate change. Welcome to all of you. Thank you again for being here today and for all the support over the past, almost 2 years now. So I'm going to kick off by starting a question for Rosie and for Emma. I'll start with you, Rosie, if you don't mind. So in recent years, and it's a question I've asked Edward Peck, but I thought good to get your reflections as someone who's working directly with students and who has worked in this area as an expert for a while. So in recent years, we have seen that uptick in students reporting mental health difficulties. What do you think is driving this, and what actions do you think universities can take in response?
Thanks, Omar, and congrats to everyone that's done all the hard work towards today's launch. So I think just to start with some positives, first of all, I think it's always worth acknowledging that for many years we felt there was a real underreporting of mental health difficulties. So to give credit to the thousands of anti-stigma campaigners, university staff who've been trying to create that culture of openness and disclosure, the national organisations who've been getting these messages out there and bringing government focus. All of those things combined and many more, I don't have time to mention, means we've had a lot more encouraging messages going to the whole population and going to students around mental health literacy. What are the normal ups and downs of life? When is it useful to seek help? I know there are people in the sector that are concerned about some of the boundaries of this and whether actually we're seeing kind of more awareness than literacy. But I think as a general point, it's a good thing that we're seeing more students being knowledgeable about mental health and seeking help. So just putting that to one side, your question was more about why do we think we're seeing an increase in distress, in symptoms, in challenges. So there are 4 things that I want to pick up. And this is, I suppose, is based on the research we also do as a charity, the work that's been done by the consortium, but also, those really regular discussions we're having all the time with students across all of our programs. So the first driver I want to highlight is about the financial factors. So most of us on this call will know during COVID, students lost a lot of financial support that they needed in terms of part-time jobs, and many had different housing and money issues. But cost of living has been a challenge for students for years. There are some very particular issues around maintenance funding and how that's not increased in line with inflation. But also data from ONS has shown that most students now are actually working alongside their studies, which does have an effect on then their ability to engage with lectures, their learning. And I spoke with a parent recently whose daughter was working until 4 a.m. And that was having an effect on her ability to make friends, to actually be present when she was in her learning environments. Was worried about affording the train home, the cost of course materials, prescriptions. This is the kind of things that are building up for a lot of students. And I know there have been recommendations by the APPG for students to government around government putting more focus here around funding. But clearly this is something that we need the whole of the system to focus on. The second driver I wanted to pick up was around environmental factors. So not enough time to get into the housing issues facing students. But I think we have to acknowledge we have a private rental market that is out of control, that is causing real concerns for students up and down the country about actually finding places to live or whether they can afford to live there. But I also wanted to broaden that point to the report that's already been mentioned about environmental factors, is also about acknowledging what's coming and the future and what we know about the climate emergency. And that report that we published yesterday really speaks to how much concerns about climate change are weighing on students now. And it's not, it's not something we can dismiss. We really have to engage, like really listen to what students are telling us, because it's showing up also in therapy rooms as well. Now, briefly, the third thing I wanted to mention is around inequality. And again, I feel to do that justice, you want to really talk about all intersectionalities here. But just to acknowledge that point about, and in particular, how much we know racialized communities have faced additional pressures in recent years. And I think there is still limited evidence as to how much across the whole of the HE sector we're really tackling those inequalities in our institutions. And making sure that all of the support we offer is really culturally appropriate and co-produced as well. And final thing, fourth issue, if I haven't said enough already, is about a key driver also being about the problems of people not getting rapid access to the right support at the right time. So we know that people's outcomes are better if they get in early and they're less likely to become more unwell. But we are seeing all the time now and hearing from students all across the country all the time, they can't get into this kind of specialist NHS care that would really help them to tackle those symptoms and experiences that they're having. I would like to see more universities really influencing the local commissioning that happens in their regions, but I know that's not straightforward either. So there's a lot there, but I think it speaks to how complex this issue really is.
I think that's right. Obviously, whenever you see a good thing in terms of trying to encourage greater reporting of an issue. So I'm also familiar with hate crime, for example, that when the police encourage greater reporting of hate crime, prevalence of hate crime goes up, but we don't necessarily know that that means that the incidences have gone up, although other data in this case does indicate that there's a greater range of student mental health difficulties, and you have outlined some very clear drivers for it. So Emma, do you have anything other reflections on that?
In terms of the drivers, I think a lot's already been said, really. I mean, certainly, yes, COVID isn't the only driver, but we've certainly seen across the sector that the sort of post-COVID years have seen cohorts of students coming through who definitely appear to be less resilient in that, than perhaps their peers were prior to them. And also with greater levels of general anxiety. And I think that's reflective of the types of issues that Rosie's just alluded to there. Certainly cost of living, again, there's ONS data that shows that many students report is negatively affecting their mental health for the whole range of reasons that Rosie covered. And then again, that transition to university more generally being that quite key milestone, that if students are already in a wobbly place as they then come through in that transition, and some of those normal support structures that they may have had at home they're then separated from them, then clearly that is a factor.
Picking that up, given you're from Amashi, which obviously is a members organization. I was curious if you have any insights into how your members have been responding to that greater need, especially in recent years.
Yeah, absolutely. So obviously Amashi work with student support services across universities, and our membership really reflects the diversity of the sector. So we cover small and specialist providers right through to larger providers with tens of thousands of students. And I think across that student profile, we also have got the whole range of age ranges as well, from obviously the school leaver coming through the traditional route into higher education, but also adult returners coming back, perhaps from a time, you know, for a career change or following a period in work, coming in back into higher education as well. So our membership are dealing with that really wide range. And some of the discussions earlier this afternoon around that whole element of context, I think, is something that's really key as well, and that the Mental Health Hub will help with in terms of us looking forward to finding those things that work. And in terms of how our members are responding to the increasing number of students presenting with mental health challenges, I think it's fair to say that given that diversity, and given the wide range of structures and services that and the ways that people are operating, providers will have service provisions which reflect their own unique context, really. But common across the sector that we're seeing now is that many providers have their mental health strategies in place, and they're looking to embed whole system approaches. Those whole system approaches are looking to cover a wide range of wellbeing initiatives, different types of community building activities, and universities are also investing in mental health services and looking at how they can develop those relationships and pathways into external services and agencies. Of course, a lot of our members and a significant number of universities are now signed up to the Mental Health Charter programme as well, of course, through Student Minds, and there are more expected to engage with that programme in the next 12 months. So I think as a sector, HE is actively engaging in the mental health space and looking to find how they can, providers are looking to find how they can adapt services to meet the needs of the students that are coming through, and working with students to co-create those solutions as well.
Thank you, Emma and Rosie. That neatly moves me on to the next question for Nicola and Nancy, which is, although we do have a lot of good practice on the ground, we do have a dearth of quality UK evidence at the same time on what works to support student mental health and student outcomes. And so, turning first to you, Nicola, why do you think there are such big gaps in the evidence base in the UK?
Thanks, Omar. And it's sometimes a little bit uncomfortable in this hub, isn't it? It's really exciting to be launching it, but we're launching it knowing that actually it points out a lot of gaps, further work that's needed for the sector. I want to pick you up on something in that question first. I don't think this is a UK gap per se. It's a global gap. And actually, I think looking at the global comparison, UK universities, higher education institutions should be really, really proud of the work that they're doing around preventing student mental health problems. I think we're doing some fabulous work in this country. The way we're thinking about mental health is changing. We're increasingly recognizing that mental health is shaped by social, institutional, and familial factors. Rosie set that out for you so clearly. For many students, the mental distress that they report stems from financial stresses. It stems from social factors, sometimes linked to inequality and honestly to structural racism and discrimination that's still prevalent in our institutions. And with that in mind, interventions that focus on treating the individual when we're thinking about mental health might not be the only tool in our toolbox. I think that's something to think about positively, right? That there are more approaches we can take to try and tackle the challenges around mental health. And the whole university approach sets that out really powerfully, giving us a sort of a wide framework to think right across the institution about how we respond to mental health in a way that looks beyond the individual and thinks about the factors related to institutional design and culture that could have a profound effect. This is all progress, right? I think this is all really positive. And I'm a researcher motivated by my own lived experience of mental health problems. And from that personal perspective, my gosh, this progress is needed. We really need this. Looking seriously at interventions that tackle social determinants of mental health problems is charting new territory. This is a new frontier, and it's a new frontier not just for higher education, but for the mental health sector in general. And it's a needed change. But it's new, right? That means that we don't have the research yet about what works. And I think, if I sort of paraphrase my answer very quickly for you, this is new. We're trying to do new stuff here. Be kind to the gaps of knowledge that we have. There's work to be done. I should say, though, that it's also a challenge in that it's an intersect between health and education. We're working on health problems in an education space. It's particularly underfunded because it's not quite education and it's not quite health. Mental health has always been underfunded in terms of research, in terms of service delivery too, probably, but in terms of research is an underfunded area. I mean, public health approaches within mental health are really the very, very, very Cinderella case of the sector. So there is less funding, and we're also talking about really complex interventions. These aren't simple things to deliver. If you're starting to think about tackling social determinants, thinking about institution-wide interventions, these aren't easy studies to run to test what works. They need robust funding. So there's lots of space to grow. There's obvious reasons why there's challenges here. And I hope that we can all work together to build a stronger evidence base.
Yeah, I'm going to follow up with you on the point around the challenges around evaluation, because I think it's a really key one. But I want to give Nancy an opportunity first to sort of hear her reflections on the evidence base, not least as you, working with Nicola and others, did some evidence reviews just a few years ago. And so you may also, like Nicola, feel that while there are some gaps, how are we doing compared to, say, what we knew 3 or 5 years ago?
Yeah, and that's exactly what I was going to start with. Okay, this is major progress. And the fact, so we were working on a similar sort of hubs approach from 2017 to 2020, and people were working before that as well. And so the fact that we're even able to update this in 2023 is huge progress. And the fact, because there's so many more studies happening now than there were then. I think this is, just to echo Nicola's point, this is generally true. So we know mental health matters more to our overall life and achievements than we did in previous generations. It's always been true, but we just know that it matters more and that there are things that we can do about it. But it is still working through generally as a field to make a lot more sense of it. And that is happening really rapidly. And so this is the moment. And I think this is the sector that can really make a difference because of its understanding and knowledge around evidence and culture of it. So I was really excited to see they took that challenge up. So when we did the work in 2020, 1919, that learning from those reviews, those evidence gaps, went into the Smarten funding, so the seed funding on research, to really grow this almost from scratch, and in areas like loneliness as well. So we didn't realise in the field of loneliness that people were lonely under age 55. Of course they are. And this is a key transition point of those lives. So we're growing this from a very early base, but it is accelerating. I think it also went into research, into action funding in the right way in terms of innovation with the Step Change Challenge funds. So there is some variations of what gets researched as well and the incentives around that. So sometimes it's easier to research some things, or there's a real incentive to research new things. And so what we've been able to uncover with these projects over the last 5 years or so is areas of practice that we could usefully research. So people, colleagues of Emma's who've been doing these things for years, actually we need to research that as well. And there are some things that are harder to research, that the methodology needs to be developed as well. And that's not something you can just do as a lone researcher. It needs to happen through projects like this. So that's quite exciting from my point of view. But there's also quite a lot of knowledge that we can pull in from other sectors, which is exciting. So whilst we don't necessarily know that something works for a student population, it's really quite good indication that stuff that works elsewhere probably works here. We need to bring it in appropriately and learn, but there's a good lot of things we can passport across. And also this wider sort of public mental health evidence base that we create in What Works Centre for Wellbeing, understanding what life is like for students. So for example, we know that it has a higher sense of purpose, but lower sense of life satisfaction, higher sense of anxiety, potentially higher loneliness for some groups. So we can start to use that information from population data to inform it. And we'll talk a little bit more about sort of the whole system approaches in a bit.
Yes, I mean, everyone's already flagged that. That is coming up as a question. But before we get to that question, because both Nicola and I think, well, you, and Nancy, and you, Emma, have raised this question around evaluation and better evaluation and the challenges of evaluation. So I'll start with you, Nicola, just because you were picking up that thread. How do we encourage universities and colleges to better evaluate their support services for student mental health and help build up that evidence base? Keeping in mind that this isn't an easy area.
Well, Omar, your hub helps, right?
Yeah, thank you. I teed you up and you yes.
But I think we should be honest that universities have amazing data to work with to evaluate their services. And they also have many actually really exciting opportunities to collect further data. It just needs some careful and creative thought. And I'd like to, if I may, give you an example from my university at King's College London about just one project that we've been running that I think gives an example of what we can do. The fantastic Professor Juliet Foster at King's has overseen many opportunities to build better connections between central King's services and academics working across the university, to try and bring in expertise from across the institution to help our central services evaluate the work that they're doing better. So my professional services colleagues welcomed my input on designing a wellbeing survey that we now run at King's. It runs annually, and due to great resourcing and support from wonderful colleagues across the Student Education Directorate, it gets fantastic responses. Sorry, I'm mincing my words there, which is, I understand now why everyone at King's uses acronyms, because we have long titles for things. Building further collaborations there, we've been able to work with some guys in my department who really understand the statistics, to then analyze data and pull insights out from these data sets. As researchers, we can't collect that data without doing it in collaboration with the institution. I really value the opportunities to collaborate with central teams at King's, to be able to get that data and then to think with them about how they use it effectively. And I'm fairly convinced that there are, well, I know from my work leading Smarten that there are researchers that have a similar passion, enthusiasm, interest at most universities across the country. The next task we need to do at King's is to think creatively about how to use the data that the institution gleans to understand more about interventions. And one thing we could do, for example, is if we've got this data set running across the university, is we could roll out an intervention in one faculty and then delay the rollout of that intervention for another faculty. We've got a nice baseline, we've got a comparison group, and we can look at the changes that are going on there. And that's one way in which we can start to evaluate complex interventions. And I guess what I'm trying to say here is that evaluating any kind of complex intervention is really difficult. But universities are in a very strong place to do it because they can collect routine data. They can work with data that's that's there in the institution anyway. And because we've got different faculties doing different things, there are many opportunities to sort of do comparison or quasi-comparison groups. I sound like a kid in a sweet shop, don't I? I think there really are great possibilities in universities to do more research here. So how do we do more of it? I think I'm hoping Emma gives you a nice answer to this, but I'm looking to her in that we need more opportunities for researchers and professional services staff across our universities to come together and to talk about research, not just talk and listen, as I'm afraid I'm doing for you guys now, but actually just sit in a room and chat and talk about what are the challenges, how do we help, how do we do this together, how do we collaborate?
That's absolutely, yeah, it's a perfect segue to you, Emma, but I was also reflecting for our work on the widening participation front. We sometimes have the same issue, right? So you have all of this expertise in universities in terms of research methods, in terms of knowing how to do evaluation, but the people delivering the WP, the widening participation programs, who really know what the service is like, how best to sort of motivate and encourage 16-year-olds to be interested in a widening participation activity, are a very different set of people, but the people who probably have the best understanding of how to develop an intervention. So Emma, how do you see institutions better connecting people who work in student services with that academic expertise? Obviously King's is a best case, but it sounds like a best case, but any insights into, because we do have quite a number of researchers actually on this call today, as well as practitioners who would probably benefit from hearing some examples of success where we see the services teams working with researchers to improve evaluation of mental health interventions.
Yeah, thanks, Emma, and thanks, Nicola. So I think as Nicola was talking there, I was just thinking about how one of the key words that I wrote down earlier this afternoon actually was collaboration. And there's been a lot of talk this afternoon around how collaborative the sector is. And I genuinely think that is true. But I think I was reflecting as Nicola was talking that while we're very good at collaborating as a sector, I wonder whether or not we're actually as good collaborating internally between professional services and academic or research teams. And I was just thinking about the fact that, obviously, most of my colleagues in the sector, student services colleagues, are in professional services. Some may have academic backgrounds, but many won't. So I think a challenge for some, or for many perhaps, when designing services and wanting those services to be really impactful, is to know, is to understand how to go about evaluating services, and how to build in those evaluation approaches or methodologies as services are being designed. And I don't think, certainly from my point of view, I don't think that I work closely enough with academic colleagues in my university on how they could help me with that. And it's certainly something I'll be taking away from this afternoon. But I do genuinely think that the Mental Health Hub does provide that useful resource and toolkit for certainly practitioners in student services, to help them identify appropriate evaluation methods. And I think as the sector perhaps internally collaborates, as we've just been talking about, and then continues to collaborate more generally, and starts to get that evaluative approach more embedded, and then feeds back into the hub, I think it then becomes that really dynamic resource that Eliza was referring to earlier in her session as well.
Yeah, hopefully, and as Eliza said, we're going to be beefing up and building on that evaluation guidance, obviously working with partners on this call. One more question before I turn to the audience questions, and I'm going to direct this at Rosie first and then Nancy, which is that whole university approach, which you've heard a lot about today, was one of the key findings of the hub, but also something that's been referenced in this conversation. Maybe starting with you, Rosie, and maybe only 2 to 3 minutes, apologies, but we want to get to those audience questions. Could you talk us through why you think it's important and how that differs from, say, previous approaches to supporting student mental health?
Yeah, so very brief background on the whole uni approach work. So several years in the making, students, university professionals, lots of the organisations on this call, and also Universities UK. So we were all working together on that more developed understanding of what a whole university approach means and how that's about supporting the whole community, students and staff. And then we took that forward as a charity, Student Minds, to develop these into principles and essentially quality standards for universities called the University Mental Health Charter. So the charter and the whole university approach underpinning it, it's really about setting out everything that should be done within an institution to create those thriving communities, from how you teach, the accommodation you provide, the support on offer, to the ways that your leaders and your whole community are actually working and interacting with each other. And I think it's really important because it is about recognizing it is about deep culture change. It's not about any one thing. It's strategic, that everybody has a role. But I think also what's been crucial for us with the charter has been that, having a framework is one thing, and colleagues across the sector are clearly doing a fantastic job of, using some of that stuff already. And many of them are already on their journey, before this work. So they're using that. But I think the bit we're adding now is a program of support that is providing spaces where people can come together and share their learning, share the barriers that are getting in the way. And then we're also adding the accountability part, because when they're ready, they can put themselves forward to be assessed through the assessment and award process. So I think that's what's kind of taking it up a level, and we're really pleased that the toolkit launching today replicates that charter structure, because it means that we're all using that same structure to talk about what a whole university approach means. And now that we've got 96 universities actually signed up to the programme and working towards that whole university approach, we've got actually a better consensus of what that approach is and why we're doing it. So that is good, because as we've already captured, it's complicated.
Yes, and I mean, it's something in previous TASO reports on both the ethnicity degree awarding gap and on disability that is highlighted as a recommendation that to tackle, one in experience of inequality by itself may not be sufficient unless you get the whole university to think through what it would mean to address disability inequalities more comprehensively. But Nancy, you definitely wanted to come in on this point as well on whole university approaches.
I did, partly because I've been trying to work out what it actually is for some time, and like, what do you actually do? It's great to say a system change, but what do you actually do? And that's what Rosie was also talking about, and you were as well just then. So it's partly about understanding who's best placed to act, and it won't always be called mental health or whatever as well. So it may not always look like something, but also we all have traditionally done quite a lot of things that really make a big difference to people's well-being, and just knowing that is also useful. But what we see from other areas of research, particularly on the workplace, for example, is that ad hoc interventions do work, and they can work. Where you see the biggest impact in both well-being and performance, but also in trust and leadership, is where you have an integrated approach across all of the things that are being done, across all the relevant domains of drivers of people's well-being, and that you monitor and adapt to circumstances. So we saw that in the pandemic in particular. Organisations that had a plan, that monitored the plan, that adjusted the plan, that was comprehensive, were much more effective and much more resilient as well. But we also know that higher education organisations have a profound impact on the well-being of the nation through a large amount of things that they do, whether we call that well-being or social impact or value, social value. But we know they impact the people that are working there and studying there, both now and in the future, but also the places that they're in and the future well-being of their nation. And I think we can get much better at understanding, valuing that, particularly when resources are tight, where we need to be effective and know the difference that we're making with the time, money, and effort we're putting in and people's lives.
Great. So we do have some questions. We've had 300 and I think almost 400 people on this call at one point. So it's great to see so many people. And we've had quite a number of questions come through, some of which have been answered by a colleague where they were sort of technical questions or questions about the project. And as I said, we will be sending out some FAQs to the questions that were asked that we're unable to answer today. One thing that has come through a few times is around the fact that there is a concern that, the evidence review found that these clinical support it has the strongest evidence base, but a concern to ensure that not everyone it may not be advisable for HE providers to be delivering that support, that there may be challenges around doing that, ethical challenges even, and I just wondered any reflections on that point from any of you. Maybe Nicola, you've got your hand up, or Rosie?
Well, Omar, Rosie might have a sensible answer for you. I have rather a contentious answer for you, which is that
go for it.
I think you see the strongest evidence base for this kind of intervention because it is the easiest intervention to evaluate. It's really easy to run a randomized control trial or a gold standard evaluation of a cognitive behavioral therapy intervention that's one-to-one, a therapist in a room with a patient. Even easier to run it because if it's delivered in the NHS, it's run in an organized, systematic way. But it's very easy then to randomize people to conditions. So I just wanted to flag that in that I think we need to have caution that where the best evidence isn't necessarily where the best interventions are. It's sometimes that actually these are the easiest things to evaluate.
No, that's definitely an issue that we found across the piece. I suppose there's a further question here around the respective roles of university. I mean, Edward Peck talked about this as well. I can't remember, maybe yourself as well, Nicola, that there's a health and an education institution kind of overlap here. And any observations, Rosie, before I turn to the next question?
Yeah, I think we hear from staff all the time that where people really want to be helpful, but also want to know where the boundaries of their role are, and just where that's really difficult. And some people here have been involved in research on this before. I think I would probably take quite a pragmatic approach, which is acknowledging, start with a student. Who is the student speaking to? We did some work a few years ago looking at the role of accommodation staff and cleaners, and it is often, a member of a cleaning team who might pick up on a student who is experiencing, say, for example, self-harm. It's not, we can't just say, no, these aren't the people. That we have to be pragmatic. We have to think, what can you give people that gives them a little bit of confidence in those scenarios? But I know that there is a lot of debate over how far different training programs have been evaluated, and that is something that we test in the charter, as we ask universities to really talk about their approach to training and where the boundaries are for different roles.
And that
So yeah.
picks up another question actually very
Mm.
nicely, which is any observations, and I think I will put this to Emma as well, any observations on the interaction between staff mental health and student mental health, particularly where academic staff, but obviously also student support staff, are increasingly asked or expected to take on pastoral and mental health support roles. And obviously that was something I spoke about with Edward earlier. And there are concerns, I think, from some academic staff around this. Emma, any observations? And maybe then ask Nancy or anyone else.
Yeah, I mean, I think it's a really important point in terms of ensuring that people have got sufficient tools, resources, training, and routes to be able to refer students on, so that they feel confident to be able to, for a student to raise an issue with them, but they don't feel that they have to resolve the issue for the student, and that staff have got the appropriate signposting referral processes so that they can safely pass that student on, and they know that that student's going to be picked up and supported supported by the professional teams, as it were. So I do think it's a big concern for academic staff as well, in terms of, that they care about their students. They want to ensure that the students are well supported, and in being caring and wanting to facilitate that support, that can feel for some colleagues that they're taking on an awful lot in that role. So I think the academic tutor role that Professor Peck was referring to, I think it needs some careful thinking through. Would be my thoughts. It's not to say it's not the right thing to do. It just needs some careful thinking through.
Yeah, no, I agree. I think he was acknowledging that, to be fair to him, but I agree. It's a I have two hands up now from Nicola and Nancy who want to come in on this as well.
I'm going to try and give the short answer to this. I think sometimes we are at risk of overthinking the role of an academic personal tutor. And the more we think about whether the academic personal tutor has, or the academic has the skills that they need to manage students' mental health and to manage students' mental distress, perhaps the more pressure we place on the academics to be able to deliver a mental health expert light kind of intervention, and forget that actually very often what our students are looking for and needing is a supportive, friendly person who can listen to them, who can think about what they're struggling with and provide a basic human response. And very often that is actually all our students are looking for. So but when we worry about identifying whether they're at risk and then who to signpost them onto, we sometimes I fear are at risk of ending up endlessly handing students on to the right person, and all they really wanted in the first place was someone to give them 10-15 minutes to have a really good rant about the stresses in their life, say, I've heard you, I've listened, I care, by the way, if you want to come back next week, my kettle will be on and we can have another cup of tea. I might be being wonderfully naive there, but I do think there's a simplicity in all of this that shouldn't be overcomplicated.
Do you want to add anything to that? That's a very nice way to to describe the
I want to pick that up. So we know from the resilience research, whether you like that word or not, but having a trusted adult, supportive friends, and regular physical activity really, really help with any adverse life events, whatever that is. So those sorts of things are simple solutions. Knowing the skills and supervision needed for those various roles and getting that right is probably very important. There's lots that can be drawn across from the workplace management literature and the volunteers literature, people who work with people in distress, for example, that we could passport over and get that right. But I think this is also part of a whole organisation approach, is thinking about this plan and the risks in that particular context. So, for example, there were risks around the occupational nature of the different jobs in the organisation, specific risks around postgraduates, for example, who are also sort of in that in-between stage. So understanding, like, know your people, know your context, know how the drivers play out in that context. Fairly standard stuff, but knowing that and knowing that's part of your plan matters. We don't actually know. We know that a teacher can impact a student's well-being from the age of 8 upwards. We can see that impact that can be lifelong, so they can make a huge difference. but we know less about sort of the well-being of the teacher or staff member and the well-being of the student. But that is starting to be tested and looked at, and in a whole range of different contexts, so we can start it in. But I think this is part of a whole organisation approach. There are ways to do it. There's lots we can bring in from other areas, but like getting it proportionate and getting a risk-based approach is absolutely the way to go. And I loved your simplicity there, Nicola, of trusted adults, supportive friends, and regular sport. Really makes a difference.
Yes, there is a question here on what's going to be now done or tried to develop the UK evidence base, and I suppose the answer to that is look at the hub and watch this space. Please do also contribute your own examples of practice. Please do also look at as the continue to come to the hub, because as Eliza outlined, the guidance and the evidence base will be updated as we go, and we are looking for examples of practice. There is one other question that I want to answer before we wind up, but I only have time maybe for 2-3 minutes on this, is on the issue of suicide prevention specifically. The toolkit did not directly capture evidence on suicide prevention, but I think if anyone wanted to say anything on this panel about that issue, because obviously it is an extremely important and urgent one, but also the point that it's been made, alternatively, you could comment on prevention more generally, right? The need to ensure that when thinking about these issues, we're not just thinking about students in distress or trying to prevent and support well-being. And so maybe does anyone want to come in on that? Nancy, you're the obvious person to talk about well-being promotion, but yeah.
I was actually going to come on suicide prevention. So
okay,
when we did it in 2020, one of the most effective and the highest quality studies was around suicide prevention, and it worked. And so I think, but it was just so different from what we were looking at here that we chose not to include it in this. But if there is a separate bit, but the suicide prevention plan that's just been published in September is really very, very good, and we'll have a place-based approach across the whole area, and the data is getting very much better, so we're able to do much more. But generally there is a larger number of things that we can do, I would call, in the face of public mental health or around the organisation, that can really just lift everything, as well as these very specific risk-based interventions as well.
Anyone else want to come in on that? Okay, I'll quickly take another point, which is around technological changes, right? So COVID and whether or not online versus in person, face-to-face, raises any particular kinds of concerns or challenges in terms of access to mental health support, maybe even opportunities, actually. Quick answer from one of you maybe on that. Anyone? Emma, I'll let you have the final word.
Oh, I don't know about that, but in terms of that online or face-to-face, I think certainly through COVID, certainly at University of Cumbria, which is where I'm based, we really saw a difference. We had to move to a different way of delivering our services, and COVID sort of forced that really. And what we've seen is that students engaged with that perhaps far more than we thought that they would. That said, it's not right for everybody. Some students don't have the right home environment to then be able to connect remotely. So it's about, again, looking at perhaps a hybrid model or what works for the context, I would suggest.
Great, and I want to now thank all of the participants, not just the 4 consortium partners right now on the panel, but obviously our previous speakers, starting off with John Blake, our student speakers, Lauren King and Emily Birchall, and of course, Professor Edward Peck. I also want to thank all of my team who've done a huge amount of work, both on producing the hub, but also on making today run as smoothly as it did. Before we go, though, I've got a quick poll. It should only take you a moment. It's about to pop up, and it's hopefully a self-explanatory 2 questions. How likely are you to use the mental health hub? From highly likely to highly unlikely. And how satisfied were you with today's launch event? You may see a little note that says hosts and panelists cannot vote, so I cannot skew the answers in my direction, but with 300 of you on the call, that would have a statistically low impact in any case. Okay, we will also be after your feedback, so do please keep an eye out for that post-event survey. As I said, we are ourselves committed to good evaluation and making sure that we run these events as well as we can. We will also be sending you any further information on the questions that we didn't answer, and Edward Peck's email to give further evidence to his task force. We're also looking at further opportunities to promote this hub in more detail over the coming months, so please stay tuned for more details. Those may be online or in-person events or blogs or other ways of promoting it. And time permitting, there will be some other upcoming TASO events in November on our other projects. And so please do sign up to our newsletter and look at our website for those events. I think that the poll is now closed. And apologies to those of you whose answers whose questions we haven't had time to answer. Thanks again to the panelists. Thanks to all of you. And hopefully you'll be using this hub. You'll be looking at it after today's launch and in the coming weeks. And let us know. Please do fill in any further evidence of practice. Let us know what you find really helpful, so that we can all collectively continue to ensure that student mental health outcomes improve. Thank you.